If you had car sickness as a child, you're prone to one of the most common overlooked dizziness conditions that we see. Because what happens with these cases is it's happening inside the brain, it's not in the inner ear. And what we're seeing is their tests will be fairly decent. They're slightly below average when we look at their balance on their vestibular, on their proprioceptive, and their visual tests that we do here in our office. But MRIs, CT scans, all that stuff's going to come back negative. And so what happens is these people are often left looking for answers because they can't find a diagnosis because it's the single most common thing that is overlooked because the tests come back normal. So what is it? It's often vestibular migraines, which is a central brain issue that doesn't cause any pain. One of the biggest misconceptions that we see when people think migraine, they think headache. And there are a lot of people that have headaches or head pain when they have a migraine, but there are many types. There's ocular migraines, vestibular migraines that don't cause any pain at all, but it often comes in waves where you get this brain fog, this dizziness, you're unsteady. It could be grocery stores, it could be driving, it could be certain situations where it just hits you and you don't feel well, you feel overwhelmed, you feel anxious, and then you kind of get this hangover period that just kind of comes in these waves and you don't understand it. This is often a vestibular migraine, and this is what people miss. This is one of the most common things we see, and it has its underlying roots in your genetics. And so what we find is by far the best way to correct this for most people is to look at the upper neck. Now, is the neck going to be 50%, 70%, 90%? We don't know for sure. It's often going to be the biggest part. Now, your stress, your diet, your hormones, artificial smells, the weather, these things can all play a part, and it's different for each person. But to correct it, the upper neck is often the most overlooked thing, and it's often the biggest thing. Now, it's not to say that we don't have to investigate those other things, because ultimately we cannot change your genetics. But if you try to do all the other things and you ignore this area, it's going to be problematic because you're not really going to get to the biggest driver of these symptoms. And the biggest driver of migraines is often happening right here at the cranial cervical junction.